What's to be done for chronic sufferers who many times confound their doctors? Are we getting any closer to a solid diagnosis and, more importantly, an effective treatment, whatever the diagnosis? I asked Lorraine Johnson. She's the CEO of LymeDisease.org, which advocates for research and treatment of Lyme. We hear the medical community, not all of it, but major parts of it, say this is not a legitimate diagnosis. Do you think that will ever be resolved?
I think it will be resolved. I think there's been an enormous amount of movement towards recognition of how serious this disease is. I think the CDC stepping in and recognizing it has been really important. But I think most people recognize that there are a lot of patients who aren't diagnosed early. We have in my Lyme data, we have 70% of the patients are not diagnosed until late. And these are patients who have later chronic Lyme disease. So they had symptoms, like 45% had early symptoms. There was a real opportunity to get in, make a diagnosis quickly, treat those patients promptly, and restore them to health. You know, most patients who are treated early get well.
You know, many times we hear that mood disorders or neurological problems are comorbid, and it's thinking that that's what's driving this. But in fact, what you're saying is maybe undiagnosed Lyme disease has actually spurred that.
No, that's exactly right. So what happens is people are misdiagnosed with depression, or they're misdiagnosed with chronic fatigue, or they're misdiagnosed with fibromyalgia, they're misdiagnosed with MS, they're misdiagnosed with a disease that has no cure. And that's a real missed opportunity, because maybe they're being given then palliative care, you know, things that relieve symptoms instead of something that addresses the underlying cause.
What is the best treatment in your opinion, or what are you asking for?
When we've gone out with my Lyme data and looked at patients and said, what's worked for you? You know, the response is 35%, roughly a third, are getting better with antibiotic treatment. Now, that means a lot of people aren't getting better, and we need better treatments. And, you know, in HIV/AIDS, they have a combination, treatments that are being used. We haven't even started exploring that in Lyme disease. And what happens is when people try a treatment and it doesn't work, people will not just sit by idly and watch their lives go by. They will intervene. They will try something. And some of these other things are more risky, and some of them don't work. So, you know, for example, stem cell therapy, we ask our patients, how many of you have tried stem cell therapy? We had 300 people in our survey. That's kind of a lot of people who had tried stem cell survey, but only 3% said it was effective.
How does this get hammered out? And is it a public relations thing? Is it a medical thing?
Well, I think it's a real combination. I think patients, it's an awareness thing. So people, you know, like Yolanda speaking out, people like Averill speaking out. These are very big things because they heighten awareness. But it's also about, you know, big data is playing a really large role in this. So when the CDC came out and said it's not 30,000 cases, it's 300,000 cases, they used 3 big data studies to do that. And you know, we're getting Quest Diagnostics came out and said, you know, in California, the CDC reports 90 cases, but we have, you know, 4,000 cases. So you start to look at different data points and see how large the problem is. But I think a lot of people are leaning in right now. So you have the laboratories leaning in, some of the insurance companies are opening up their databases.